Thank you, everybody, for joining us. We're looking forward to showing you some of what's very popular with our IPC clients, and hopefully you find something that's of interest to you. Angela, over to you.
Hey, hi everyone. Thanks for making it today. Yeah, hopefully you'll see something interesting today, or you get a bit of a different perspective about how your own workflow works in IPC and your processes and what you're doing. So we're gonna welcome you to the Global Tools and Strategies Revealed. So I've got a couple of interesting things. We've got our top 5 audits in MEG, and I'm going to do a live. I'm just gonna start that, and we're going to do a bit of a deep dive into some of the KPIs, key KPIs, and the best in class kind of effective dashboard setups. I'm going to show you an interactive dashboard so you can get a bit of a look and feel for the product in a more fluid way. And then we're going to just have a brief look at some of the kind of success stories that MEG's had with other clients, and then we'll have a Q&A. So Helga is going to be doing the Q&A. So if you want to pop your questions at the end in the Q&A section there, Helga will read those out, or you can raise your hand if you prefer that, and someone will unmute you and you can ask your question at the end. Nothing too spicy for the questions, I hope. So just to give a bit of a overview about MEG, like what is MEG? So we're a platform that provides cloud-based risk, quality and compliance. So we're a management system that we designed and worked with clinicians to elevate healthcare standards. So we support healthcare professionals globally, enhancing compliance with local and international healthcare regulations. We're very committed to IPC, actually. That's where we started as a company. And our audit management module has become a bit of a go-to tool for IPC teams to help support their needs. So we've just got this graphic here, just demonstrating some of the other modules that MEG offers. So we've got like CQC or ward accreditation in the UK. We've got patient experience and risk management, and we integrate with the LFPSC in the UK if you're in the UK. So how do we help exactly? So MEG enables IPC teams by offering tools that streamline really complex processes, like monitoring, reporting of hand hygiene practices or hygiene practices broadly, like environmental cleanliness and compliance with safety protocols. So with the help of like the MEG technology, it's automated a lot of essential tasks and it saves a lot of time for people, but it also improves the accuracy and consistency in the data collection and analysis because it's very configurable. And like we can configure question sets and set up dashboards in a really nice way that displays the most critical data that you want to see, like exactly tailored to your organisation. So, I mean, all of that stuff just offers better decision making, a more proactive approach to managing infection risks. So basically, I think the big thing is the real-time data access that's provided on MEG. So it enables teams to immediately identify potential compliance issues and infection risks. And you'll see this on our example dashboard, which is kind of coming at the end anyway. So that's kind of MEG as a company. And then a little bit more about us. So we're working with health and social care across acute, community, mental health, ambulatory and aged care. So we're working in the UK, Northern Ireland, Australia, and we're working in public and private organisations. We're working in the LATAM kind of area. MEG's used in over 20 countries. I think I mentioned we started in IPC and our first trust was Guy's and St Thomas, and they're still with us, building up their use of MEG and building the foundations of their own IPC. And I think I mentioned there's a little icon there about the configurability, and it's the most kind of impressive part, or the most impressive part I see customers like really get excited about is the configurability of the system, about changing data sets and looking at really deep diving into your own organisation's KPIs. And I suppose, and the other great thing about the company is our employees, and a lot of us have backgrounds in healthcare. We've got like dentists and nurses, we've got doctors on the team working across all of the departments, from like implementation in marketing, sales, and all of that kind of thing. So we're all very interested in helping in healthcare. So these are some of our customers. So we've got our public customers. So we're working with some of the largest public sector hospital groups in Ireland and the UK. So obviously in the UK, we're talking about trusts and ICBs. We're working with a lot of privates. We're working with M42, who are in Abu Dhabi. They've just signed a 5-year contract to implement MEG across all its healthcare facilities in the UAE. We've got Calvary in Australia, which is actually where I was born. Not the Australia part, but actually in the Calvary Hospital, just coincidentally. So like they're a national public and private hospital group in Australia. So they cover residential care, they do retirement living and home care service centres. And then we've got customers in UC Christus, which is the largest private healthcare network in Chile. So they're also one of our clients. Okay, so first of all, it would be great if I could ask you what your guesses are about the IPC tools. What's the top 5? But unfortunately, I think we don't have time. So I'm just going to plow straight in, and I'm going to start at number 5 and do a countdown to number 1 of our top digital IPC forms, just to keep everyone on the edge of their seats. But I'm sure you already know actually what they are because you're using them, obviously. But this top 5 has been selected by looking back over the last 3 years of data in MEG and ranking the global IPC related forms by volume. So it's like based on the number of submissions. So what have we got here? Number 5, we've got antimicrobial stewardship tools. So they track and report on antibiotic use and infectious disease management. These would also be of interest to your pharmacy teams. So that's number 5. And I'm just going to show you a very nice dashboard. And if you're not familiar with MEG, you can see here on the left, we've got like a mobile device, and that's the interface for people who are collecting, auditors who are collecting data on like a tablet or an iPhone. You can use MEG on a WOW or on a desktop as well, but that would be like the visual of the mobile device with some question sets there. And then we've also got, gosh, it's very small, isn't it? Should have put my glasses on. So we've got just a nice dashboard about the antibiotic name, how it ranks over time. We've got pie charts about the duration of drug use and a few more things like that. But this is all configurable. We'd be able to set this up to your question set, so you get a nice overview. Got a nice heat map up there actually as well about question compliance by ward. So you can see that's just got amber and green on there, but that's kind of the RAG rating. So you can see on the heat map, we're going to talk a little bit more about heat maps later. Okay, we've got number 4. Coming in at number 4, we've got the international patient safety goals that are detailed by the Joint Commission accreditation standard. So that's obviously to encourage specific improvements in patient safety. And they, you obviously know this, but they focus on 6 key areas identified. And so goal number 5 actually relates to reducing the risk of healthcare associated infection. So these follow the management of IV lines as well as the CORTI, the VAP, CVC, PVC, these kind of ones. I have a live kind of dashboard to show you about that as well, which will give you a better idea about how you might not interpret the data, but how you might display the data and segment it out and really drill down into your KPIs. So we've got like a question set here from the from the goal 5. So this is more or less the interface of the app that could be used on the mobile device or a WOW or desktop. And this is the goal 5 question set. So people would go through and just fill out the free text. Things come from a drop-down menu, and you can select. It's very easy to use these radio buttons. You just touch them or click on them, and that's the process of collecting all of your data. So this question set happens to be for PVC. Okay. Coming in at number 3, this is a great crowd favourite, the environmental audit tool. We have a lot of functionality around this actually in MEG. and we've got great functionality that I'm not going to go into today about quality improvement planning and creating tasks and closing the loop here. So, yeah, it's not number one, but it's up there. It's in the top 3. So I know that there's lots of different requirements and everyone has their own question sets that relate specifically to their hospitals or care homes. And during the implementation of MEG, we would work with any potential clients or our existing clients to make sure that they're collecting the exact data. So it's displayed in the right way. You're getting the information you need. It's meaningful. So it's about collecting meaningful data. And this is just actually all of the different sections on this particular environmental one form. Yeah, so we know that the IPC UK kind of environmental standards very long, and not everyone audits against those. So you could customize that and use that as a starting point. We have forms in our library, in our IPC library. So this is the list of all the different sections that the auditor would be auditing against. So like we've got sharps management, patient areas, but as I say, these question sections could all be configured to your own needs. So I'm just going to cough here. Will I mute myself? No, I'll just cough. Excuse me, sorry. Yeah, so this is kind of like just a breakdown again about the image of the user experience, like the auditor or data collector, like these nice radio buttons. We can have drop-down menus. We can make some of the sections mandatory or not. So there's a lot of kind of different ways we can present that to the auditor, but it's just very user-friendly, and we don't really find that people need a lot of training. Yeah, they can pretty much just download it on their device and get started. And number two, so this is a very foundational audit, I would say, if I was talking about audits in an expert way, which I'm not, but we've found that hand hygiene is very popular. We're going to have a look at this in the live environment as well, and you'll see here, like I just mentioned about the mandatory section. So this red sections here are highlighted in that pinky colour. So they're mandatory for completion. And then these blue options are, blue areas are optional. But you'll see on this hand hygiene dashboard, I'm going to show you actually, like the collecting the optional data as well, just gives very rich information. And then number 1, PPE compliance. You probably knew that already. Is it a surprise? A surprise number 1? No, probably not. So PPE helps teams evaluate if staff are safely complying with the donning and doffing. And then we've got a couple of different versions here. So I suppose one of the things about MEG software is the idea about conditional logic. So we've got like it's all kept in the same kind of bucket, but as soon as you select if you're donning or doffing, then you'll get a different set of question sets. So we can see the one on the left here is the donning, and then the one on the right is doffing. So the doffing has slightly less info to capture there. But we can view all that data and check out all of the results from that on our dashboards. So we've got a really large reference library actually of IPC audits that are designed for different settings and specific institutional requirements. I'm just going to leave this up for a second. I might just take a quick glass of water, and then we're going to have the next slide. We're going to look at the KPIs. It'll be 2 seconds.
Take your time, Ant.
Now, okay. So let's have a quick look at a deep dive into key KPIs. So this is a list here actually of all of the most commonly tracked KPIs on MEG. So we've got a lot of different breakdowns. We've got a lot for hand hygiene actually. So we've got like a percentage compliance for PPE protection. We've got hand hygiene kind of looked at by moment, by staff and ward. And we've even got like the volume of glove use, because yeah, someone's obviously tracking all of the non-mandatory areas. And then we've got some kind of outliers there about tracking information on staff education, on waste management, and a percentage breakdown of PVC, CVC in use. So I'm just going to show you a few more examples of what our dashboards might look like in that instance. So this is kind of an example heat map of the hand hygiene compliance. We can see the red, amber, green kind of colours there for the compliance rating. So like that's the scoring as dictated by you with the pass rates, and that can all be customized. So whatever your pass fail and rates are, we can configure that in the system. And it gives a very good visual kind of snapshot of potential areas for improvement or something you might need to investigate a bit more. So you can see like room 3 there's a bit red, room 2. So I'm going to do a quick deep dive into that on the live section. So this is the first section from the environmental audit. So that's section A, that's like the general environment question sets. You can see on the left-hand column, we've got the questions in that section, and then just like how each location performed in that section on each of those question sets. Obviously, like all of the locations, wards or rooms, or the community locations would be configured to your own needs. So you'd be looking at your own data in your own different locations there. We've got like, this is like a demo account. So we've got like just generic room name numbers. So we've got our CVC full report here. This is a pretty comprehensive dashboard actually for CVC. So you'll see we've got the RAG rated heat maps. There's a leg table at the top there. It's pretty small, but on the top right of the first screenshot, we've got run charts and bar charts. In this case, given compliance by question. So I'm going to show this in a bit more detail as well. But this is kind of just to give you a bit of a flavour about what's possible for each of the different audits. So we thought we might give you a bit of a look at some of our best-in-class effective dashboards. So I suppose when a client comes on board and they tell us what they need and what their kind of pain points are, our implementation team set up their account, and they would, in that process, they'd set up a set of dashboards. So we've got like a standard set, for example, that would show like hand hygiene, PPE, all of the kind of audits that you're intending on auditing against. For an individual location, or we can work with you to customise dashboards which give you organisation-wide oversight, kind of board level reporting and strategic KPIs. All of the dashboards actually have like a filtering logic at the top, and you have the ability to refine information as a very standard kind of part of our dashboard. Yeah, so that's available anyway, but these custom ones, which I'm just going to show you next, are some examples of best-in-class dashboards. So they would be aggregating data from across acute and community sites. So that could give you a bit of a flavour for what's possible for building custom dashboards. So we obviously got permission from our best-in-class clients to show this anonymised data. I won't tell you who it is. So what have we got here? So we've got a very nice IP&C oversight slide here. So we've got the average compliance on the top left-hand side with a overall percentage compliance. To the right, we've got audit scores over time with these little tiny arrows, which you might not be able to see because the screen's pretty small, but you can see over time the little arrows indicating if the score is moving in a particular direction, which gives you just a little bit more kind of assurance about how what the trends are. We've got a very nice hand hygiene dashboard here that a customer has set up in a customised way. So like the hand hygiene, if you fill out this non-mandatory fields, it gives you very rich data. So like you can see the fields that were recorded in when the audit was completed about the time taken and the barriers to correct techniques. So they're all appearing in these kind of pie chart configurations. Here's our number one form. So this is PPE dotting and doffing. So the top tiles there, the top 3 tiles with the little percentages, they give an overall compliance overall donning and doffing, and then it's broken down by donning and doffing. And we've got this kind of compliance over time. We've got quarterly compliance. We've got heat maps there as well. So like people can really drill into their information and see what's happening at a glance. Here is our environmental audit form as well. So we've got the RAG rating, bar charts, heat maps, which I'll have a look at live next. I'm just conscious of the time, so we'll just to mention that MEG integrates with other MEG modules, obviously, like risk and LFPSC and document management, as well as like the trust IT systems and databases. But like we would integrate with Power BI or electronic patient records or Active Directory for single sign-on, that kind of thing. If anyone wants any specific information for technical people, we can send that on after. So let's have a quick looky look. I was going to show 3 forms, but I think that's actually ambitious. So I'm just going to have a look at IPC environment and then the maybe IPGS Goal 5. So let's just have a look. I'll just switch this over. Where will we start? Let's have a look there. Can you see that, Helga? I can see you if you nod.
Yeah,
you can. Cool.
That's come up. Thank you.
Super. So we've got our live dashboard that's got our overall compliance. So this is giving us all of the information about all of the different sections. We've got a percentage here. We've got like the compliance by environmental section. We've got our heat map here. We could take a look here and say, actually, Theatre 3 isn't doing so well. So let's just have a quick look in Theatre 3 and have a look and see actually what's going on. Let's have a quick look. Very red. Where are they kind of falling down? Where could they have improvements? So we can see the percentage compliance here again. We can see all of the areas that could do it with improvement. We've got a couple of amber sections. So this is kind of how you can really drill down and see what's happening with your data. Let's just have a look at the dashboard again for this one. So we've got this. We've got this set up for. I'll just clear that out there. So we can see our different section breakdowns here on a heat map as well. So the section A through section B, patient areas, we can see that. We can see a detailed report, which gives a general environment kind of compliance overview. And we can also see like our issue statistics. So we can see what's open, most common issues. And that's a bit more related to our quality improvement planning. Slightly different, but just to know that exists. Then let's just, in the last couple of minutes, we'll have a quick look at the IPS Goal 5. So we can see this overall compliance dashboard that we've set up, which is pretty nice. Gives you the breakdown, CVC, PVC, gives you the overall compliance, the dates, audits by community location, over time. We've got like a leaderboard here. If we had a quick look at CVC just in particular, we've got the overall compliance. We've got by acute and community, if you wanted to set it up that way. We've got a heat map here, compliance by ward. We've got forms submitted. So there's lots of different options there. And then one last quick look at hand hygiene, because that can just be a very, well, it's our number 3 form, but it can be a very very nice way to kind of have a look. Let's have a look at this detailed report here. So this one is great. It gives you a nice breakdown about the opportunity for hand hygiene by staff member, by indication, before touching patient. Like it's got all of the different, we can even configure those for you, and then the method observed. So it's like there's lots of opportunity there for capturing data and just making sure all of your kind of data you're collecting is what it's what you need to know. So I feel like we've only got 5 minutes left. So what do you think, Helga? Will we just go straight to Q&A?
Absolutely.
Yeah.
If anybody does have questions to ask, just raise your hand. We'll unmute you. But I think Emma has a couple of questions that have been put in by people who are interested. So our clients maybe down in, I think it's Australia. Emma, you you had questions for or from? No?
Gone shy.
Do I need to unmute you?
They're in the Q&A, Helga.
Thank you. So what is the process for adding new forms, Angela?
So I suppose the best process would be you would send an example form, the form that you would like to use on MEG. You would send that across to us. We'd take a look. We'd pop that form up for you. There'd be a period of testing and just confirming that all of the question sets are as you'd like them. We'd go through, we'd set up your dashboards. And then once you're kind of satisfied with how everything looks and feels, then, it would go live then. Would be on your account. It would be contributing live data into your dashboards. Does that sound about right? Yeah.
That sounds about right. And also that where possible, if you come in through your account manager, and if you don't know who your account manager is, it'll be one of us on the sales team. So we'll help you streamline that process. Thank you, Angela. Question from Catherine. Sorry. Are the action plans automatically generated, and can you assign actions to more than one person?
They're absolutely automatically generated. You can tag people in them. You can assign one person and then tag others if that's kind of a multi-task, if you need more than one person working on that. But we would work with you to make that workflow match. Your own workflow would make that match in MEG. So might be a little bit more tweaking, but I'm sure we could, make that work.
Perfect. Thank you. And John has asked, will the slides be sent out? Yes. The whole webinar will be shared, John, and I presume that includes the slides.
Because we didn't touch on, there's a couple of client case studies actually that we didn't get to, but that'll be on the slide deck if people want to take a look at that. It's Guys and Tommies and then a New Zealand hospital in Waitemata.
Perfect. Perfect. Are there any more? Emma, do you have any other questions? No? Okay. Well, maybe we'll give people back the gift of 2 minutes.
It's long enough to eat a sandwich.
Exactly. Oh, wait, now there's one more there's a new one. The implementation process. Angela, can you speak to that, or would you like me to talk to that?
Go on, Helga.
So the implementation process it's the whole idea of where the sales team coordinate with the client and our colleagues who are going to build out your forms. So it's making sure that you have everything you need to ask all the questions to understand what you want your reports to say, and we'll work with you then to make sure that the dashboards are customized to your specifications. And it also the team, Angela has said that a lot of them come from a healthcare background, so they will also help you, do best in class dashboards, or they'll certainly speak to what others are doing, and they can share that expertise with you. So we can, and if any of you want a meeting with us and the implementation team, just let us know. Angela's contact details are up on the slide, but we'll share all of our contact details, and we can go from there.
Yeah, we'd be happy to jump on a call if there's something interesting here that's piqued your interest and you'd want to talk about it, in a more detailed way. That is no worries. Sure, we like a chat, don't we, Helga?
We do love a chat.
We do love a chat.
Folks, thank you very much. Angela, thank you. Go have a well-deserved glass of water, and we will share, as I said, the slides and the recording, and we hope you'll join us again soon. Take care.
Yep. Thanks, everyone. Thanks for your time.
Bye-bye.
See you later. Bye. Bye-bye.